Hi, hello everyone. So today we are going to discuss about rheumatoid arthritis. So pharmacotherapy of musculoskeletal disorders. In that, the first one is rheumatoid arthritis. In rheumatoid arthritis, what is rheumatoid arthritis? It is nothing but it is inflammation of joints. The first thing we have to discuss is etiology. Etiology means causative factor. So the causative factor for causing this rheumatoid arthritis is autoimmune disorder. So it occurs internally, so that is why it is an autoimmune disorder, and it is also caused due to genetic predisposition of HLA-DR4 and HLA-DR1. And some environmental factors like smoking and infection will also cause this rheumatoid arthritis. Epidemiology, it is mainly prevalent in 0.5 to 1%, and it is more prevalent in women when considered with men. So commonly it begins in age of 30 to 50 years. The clinical symptoms are symmetrical joint pain, the pain which occurs in joints, and morning stiffness. During morning time, there is a stiffness with the joints for greater than 1 hour, and it also causes swelling, warmth, and redness of joints, and it also causes fatigue and low grade fever. So these are the symptoms of rheumatoid arthritis. Next, pathophysiology of rheumatoid arthritis. So pathophysiology, mainly how it will affect is it causes autoimmune activation, and because of autoimmune activation it immediately causes synovial inflammation. So synovial inflammation means nothing but it is a swelling and irritation of synovial joint, and it also causes pannus formation. Pannus formation means nothing but there is some inflammatory cells which forms over joints. So because of that formation, it leads to destruction of cartilage and bones, and it lead to rheumatoid arthritis. And also it may be caused due to cytokinins and TNF alpha factor, interleukin 1 and interleukin 6. These are the inflammatory mediators. These also causes rheumatoid arthritis. And diagnostic test, the diagnostic test, first we will go for blood test. In blood test, we will check rheumatoid factor RF and anti-CCP antibodies and erythrosedimentation rate, and also CRP. CRP means nothing but C-reactive protein levels in blood. And through X-rays, we will check for joint space narrowing. If any narrowing is there in the joint spaces, or if any erosions are there in the spaces, we have to check with X-rays. And we will also do ultrasound and MRI scan for knowing if any synovitis or joint damage is there or not. For checking that, we will go for ultrasound and MRI scanning. Next, pharmacological treatment. Pharmacological treatment of rheumatoid arthritis mainly involves giving NSAIDs, which relieves pain. NSAIDs means nothing but non-steroidal anti-inflammatory drugs, which mainly relieve pain to the patient. So, and also the corticosteroids are given in the short-term inflammation control, and DMARDs are given. DMARDs means nothing but disease-modifying anti-rheumatoid drugs. These drugs like methotrexate, sulfasalazine, leflunomide. These are the drugs which can be given as an DMARDs. And also biologics which are produced from biological being is given the drugs like etanercept, infliximab, and adalimumab. These are the drugs which are produced biologically and used in rheumatoid arthritis. And non-pharmacological treatment mainly involves physical therapy, which is given to the joints, and a regular exercise, occupational therapy, and some techniques which are used for protection of joints, and some assistive devices which can be used for assisting the joints, and also some diet modifications like we have to take some anti-inflammatory diet. So this is the non-pharmacological treatment for rheumatoid arthritis. Next one is osteoarthritis. Osteoarthritis is nothing but it is a degenerative joint disease. It mainly occurs due to aging, obesity, joint trauma, and repetitive stress. And mainly it occurs in joint disorder, and it affects mainly 10 to 15% of adults which have greater than 60 years of age, and it is also more common in women after menopause, after menstrual cycle pauses. It is more common in women. And clinical symptoms involves mainly joint pain, which is worsened by activity and relieved by rest. Means nothing but in rest you don't feel that much pain, but when you are doing something you will feel a lot of pain in the joints. And also it causes morning stiffness of joints for less than 30 minutes. And crepitus means nothing but crackling sound of bones. Some sound may be heard in your bones. That sound is called as crepitus. And a decreased range of motion will occur. And it also Heberden's and Bouchard's nodes will occur. Heberden's and Bouchard's nodes means nothing but it mainly occurs in the hand finger bones. Next, pathophysiology. Mainly, the cartilage degradation is mainly due to the imbalance in synthesis and degradation, and it also subchondral bone sclerosis. Subchondral bone sclerosis means nothing but subchondral means below cartilage. Sclerosis means abnormal hardening, means below the cartilage abnormal hardening of bones will occur, so that is called as subchondral bone sclerosis. And osteophyte formation means nothing but some bones will come out, so that is also called as bone outgrowth. This will also occur due to osteoarthritis. Next, diagnostic test involves mainly x-ray is done for joint space and for knowing osteophytes and subchondral sclerosis. Next, no specific lab markers are specifically there for this osteoarthritis. Next comes pharmacological treatment and non-pharmacological treatment. In pharmacological treatment, mainly we will give drugs called acetaminophen and NSAIDs for pain relief, and also we will give topical analgesics like capsaicin, diclofenac. And intra-articular corticosteroids will also be given for treating osteoarthritis, and viscosupplementation like hyaluronic acid can be given for this osteoarthritis. And non-pharmacological treatment mainly involves any type of joint disorders. Main non-pharmacological treatment is weight reduction and also physiotherapy and muscle strengthening. And some assistive devices can be held for reducing this osteoarthritis like canes and braces. And heat and cold therapy will also be provided. And joint replacement surgery is the occur. The joint replacement surgery can be done in severe cases of osteoarthritis. Next disease is gout. The gout is mainly occur due to hyperuricemia, means hyperuric acid levels that is greater than 6.8 milligrams per deciliter. If it is present, then it causes gout. The main risk factors for this gout disease are high purine diet, alcohol, obesity, renal impairment, and medications like thiazides can cause this gout disease. And epidemiology mainly involves, it is mainly more common in men who are having greater than 40 years of age, and it is prevalent 1 to 4%. And clinical symptoms of gout disease mainly sudden onset of severe joint pain, and it causes redness, swelling, and tenderness at the joints. And due to this, fever may be present in the patients, and it also because tophaceous deposits will be seen in the chronic cases. So tophaceous deposits means nothing but tophaceous means accumulation of tophi. Tophi means nothing but it is a cluster of uric acid. The cluster of uric acids are called tophi, and this accumulation of tophi is called as tophaceous deposits. And it is another symptom. And pathophysiology mainly, it occurs due to uric acid crystals. So deposition of monosodium urate crystals in joints can cause the gout, and it is mainly caused by neutrophil infiltration. This neutrophil infiltration will also lead to inflammation. Next, diagnostic test mainly serum uric acid levels are tested and joint aspiration is done. Next, X-rays are done for chronic gout and renal function tests are also performed. And pharmacological treatment mainly involves for acute attack of gout, NSAIDs are given, colchicine and corticosteroids are given. And for chronic management, allopurinol, febuxostat are given like xanthine oxidase inhibitors, and also probenecid, which is a uric agent. It is also given as a treatment for gout. And non-pharmacological treatment involves mainly low purine diet. Low purine diet in the sense you should not take red meat, seafood, and alcohol. And hydration is highly necessary in the gout, and also weight loss should be there. Avoid triggers like alcohol and diuretics. You should not take more alcohol and diuretics for avoiding this gout. Next, spondylitis. So spondylitis is also called as ankylosing spondylitis. It is mainly due to autoimmune disorder. It is also an autoimmune disorder which is strongly associated with a gene like HLA-B27, and it is often idiopathic. Idiopathic means nothing but we don't know the reason, exact reason for causing this spondylitis. It comes suddenly. And epidemiology mainly involves, it causes mainly to young adults of 15 to 30 years of age, and it is most common in males compared to females. Next, clinical symptoms mainly chronic back pain, stiffness, and sacroiliac joint pain. So sacroiliac joint pain means nothing but sacroiliac joint is the joint which connects lower spine to the pelvis area. So this is a joint which connects lower spine to the pelvis area. And if a pain occurs at that spot, then it leads to spondylitis or spondylitis. And it is also another symptom is reduced spinal mobility, means spinal mobility movement will be reduced. And bamboo spine. Bamboo spine means nothing but your spinal cord will appear like a bamboo stick. Next, pathophysiology, mainly it causes swelling of enthesis. Enthesis means nothing but where the ligaments and tendons are attached to the bone. The swelling exactly occurs at that region where ligaments and tendons attach to the bone, and that is the inflammation. And it also occurs due to new bone formation. It leads to fusion of vertebrae. And chronic inflammatory mediators like TNF alpha and interleukin 17 is also will also be a reason for this spondylitis. Next, diagnostic test, as usual, we will go for X-ray and the gene testing and elevated ESR and C-reactive protein levels in the blood. Pharmacological treatment involves mainly NSAIDs, non-steroidal anti-inflammatory drugs of first line are given for this spondylitis, and DMARDs, as we have discussed in the rheumatoid arthritis, that is DMARDs, that is disease modifying anti-rheumatoid drugs like sulfasalazine will be given during peripheral arthritis. And TNF inhibitors like etanercept, infliximab are given, and interleukin 17 inhibitors like secukinumab can be given in these spondylitis cases. And non-pharmacological treatment mainly involves the regular physical therapy and posture training. Regularly, physical therapy should be done, and posture training, the standing position and sitting position can be trained properly for avoiding this spondylitis. And next thing is swimming. Swimming is one of the best exercise for not getting this spondylitis, and breathing exercise can be done, and avoiding smoking is the most important thing. Next, systemic lupus erythematosus. Systemic lupus erythematosus is one of the another autoimmune disorder, and it is the genes like it mainly caused due to the deficiency of genes like HLA-DR2 and HLA-DR3, and it is also caused due to environmental triggers like UV exposure, infections, and drugs like hydralazine. And epidemiology, it is mainly present in 20 to 150% in 100,000 of individuals, and women are more prone than men, especially in the reproductive age. Clinical symptoms are malar rash. Malar rash is also called as butterfly rash, which appears, and photosensitivity and arthralgia, that is arthritis, joint pain, fever, oral ulcers, renal involvement, and CNS symptoms like seizures and psychosis can also be occurred due to systemic lupus erythematosus. And pathophysiology, mainly it is due to autoantibody formation, immune complex deposition, and multi-system inflammation. And diagnostic test mainly performed are anti-nuclear antibody test, and urine analysis is done, and CBC complete blood count is done for knowing anemia and leukopenia, and kidney biopsies can be done in the cases like lupus nephritis. And pharmacological treatment mainly involves NSAIDs, non-steroidal anti-inflammatory drugs are given for joint pains. Anti-malarials like hydroxychloroquine can be given, and corticosteroids can be given for treating the systemic lupus erythematosus. And immunosuppressants like azathioprine, cyclophosphamide can be given for treating this. And biologics like belimumab can be given for treating the systemic lupus erythematosus. And non-pharmacological treatment mainly involves protection from the sun, and regular monitoring of renal functions and complete blood count, and stopping the smoking, and low sodium and renal friendly diet can be given in nephritis cases. and stress should be reduced and the patient should be counseled. So this is mainly about the pharmacotherapy of musculoskeletal disorders. Thank you. Jai Hind.